therapeutic communication, and motivational interviewing. On NCLEX, you are rarely asked what to say because it sounds kind. You are asked what a safe therapeutic nurse would say next. Today, we're breaking down therapeutic versus non-therapeutic communication, motivational interviewing, and how all of this connects to clinical judgment and NCLEX success. Communication is not only a soft skill, it is a clinical intervention. How you speak directly affects patient safety, assessment, and outcomes. Therapeutic communication is purposeful and patient-centered. It helps patients explore thoughts, feelings, and behaviors. It is professional, intentional, and grounded in assessment. Therapeutic techniques include open-ended questions, reflection, validation, clarification, silence, focusing, and summarizing. These responses keep the conversation open and support deeper assessment. A patient says, "I don't think anyone really understands how hard this is." A therapeutic response would be, "It sounds like you're feeling very alone right now." This response validates emotion without fixing or judging. Non-therapeutic communication may sound kind, but it blocks assessment. It often minimizes feelings, shifts focus to the nurse, or ends the conversation too soon. NCLEX frequently tests non-therapeutic traps, giving advice, offering reassurance, approving or disapproving, changing the subject, sharing personal stories. These responses feel helpful, but they stop therapeutic exploration. A patient says, "I feel like I'm failing at everything." A non-therapeutic response would be, "Don't be so hard on yourself. You're doing great." This minimizes distress and shuts down assessment. Motivational interviewing is therapeutic communication with intention. It supports behavior change while respecting patient autonomy. The nurse guides rather than directs. Motivational interviewing uses the OARS framework: open-ended questions, affirmations, reflective listening, and summaries to support patient-centered change. Open-ended questions invite patients to explore their thoughts and feelings. Affirmations recognize strengths and efforts. Reflective listening demonstrates understanding and validates the patient's experience. And summaries help organize key points and reinforce insight. Together, these skills build rapport, deepen assessment, and support clinical judgment while respecting patient autonomy. Motivational interviewing is built on 4 principles: express empathy, develop discrepancy, roll with resistance, support self-efficacy. A patient says, "I know therapy could help, but I don't think it's for me." An "am-I-informed" response would be, "What concerns do you have about therapy?" This keeps the patient engaged and supports readiness for change. When communicating with a patient, ask yourself, does my response promote assessment? Is it patient-centered rather than nurse-centered? Does it avoid advice and reassurance? Does it support safety and professionalism? Therapeutic communication reflects compassion, empathy, non-judgmental active listening, and professional curiosity. It is purposeful, not polite conversation. Motivational interviewing is not about convincing. It is about clinical judgment. Both are therapeutic tools used in patient-centered nursing practice to support assessment, clinical judgment, and behavior change. And this is how you begin to think like a nurse.